Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, welcome to a new lecture today. Now, this is a practical session, so I thought I would give a small insight about the surgical aspects. In that, I would like to deal about appendicectomy. Appendicectomy. As you know, in our college we have different surgeries. We'll have to pick one of the surgery and we'll have to explain about that surgery in a systemic way. So I thought I would explain each and every surgery so that it becomes easier for us to understand. So now, the first surgery which I would like to discuss today is appendicectomy. So first, what are the indications of appendicectomy? When do we do appendicectomy? So appendicectomy is removal of appendix, right? So when do we remove appendix? One, it can be due to acute appendicitis. Okay, in acute appendicitis, it is an emergency situation and we will have to do an appendicectomy. The second type is whenever there is recurrent appendicitis, then we will have to do an elective appendicectomy should be done. So these are the two indications for appendicectomy. Now, what are the contraindications of appendicectomy? When do we not do an appendicectomy? It is contraindicated in appendicular mass. Okay, next, how are we going to, what is the anesthesia which we give? Anesthesia mostly we give, it can be done either under general anesthesia or it can be done under spinal or epidural anesthesia. It can be done under general or spinal or epidural anesthesia. Now, how are you going to prepare the patient? So first, you will clean the first and foremost, it is the position of the patient is supine position, and then you will clean the patient from with the iodine or spirit or bethadine iodine from the level of umbilicus. You will clean till the level of upper part of the below thigh. So till here you will clean the patient with the help of spirit, and then after cleaning it with the help of spirit, you will first make an incision. So there are different incisions which are available for appendicectomy. If you see, there are different incisions which are available for appendicectomy. One of this incision is called as McBurney's grid incision. In McBurney's grid iron incision, it is the most popular incision which is given. So here you will first note the spino-umbilical line. What is spino-umbilical line? It is a line which is joining the anterior superior iliac spine to the umbilicus. This is spino-umbilical line. So in the spino-umbilical line, there is a McBurney's point which is in the lateral 1/3 and medial 2/3. So this is the McBurney's point. So at the McBurney's point, perpendicular to this spino-umbilical line, you will draw an incision, and this is called as grid iron incision. Okay, what is this grid iron incision? We will first draw a line from the umbilicus to the anterior superior iliac spine, a line that is spino-umbilical line. Just perpendicular to this line, you will give an incision which is grid iron incision in the lateral 1/3, that is at the McBurney's point. So this is called as McBurney's grid iron incision. There is one more incision which is placed at the McBurney's point itself, but here the incision which you give is a transverse incision. Here you will see the McBurney's point, but here you give a transverse incision at the McBurney's point. So this incision is called as Lanz incision. Okay, this is Lanz incision, where you give a transverse incision at the McBurney's point. Then there is one more incision which can be given, which is a right paramedial incision. Here, this is right paramedial incision. This is given when the diagnosis is in doubt. So it is mainly used for exploratory laparotomy. Now, most of the cases are now managed by lower midline incision. Right. Once you have given the incision, you'll have to open the layers. So you will open the skin first and then 2 layers of subcutaneous tissue, namely the superficial fatty layer and that is camper layer, and the deep scarpous layer are opened, and then you will open the external oblique aponeurosis, and then you will open the transverse internal oblique abdominal muscles, and also transverse abdominal muscles are split. Okay, and then the peritoneum is excised. Once you have excised the peritoneum, you will trace tinea coli. So if you trace tinea coli, all the tinea coli will lead to the base of the appendix. Even after tracing the tinea coli, if you are not able to identify the appendix, then it is that you are tracing tinea coli of sigmoid colon. So you will have to trace it in the opposite direction to find the appendix. So once you have found the appendix, now you have found out the appendix. After tracing the tinea coli, you have found out the appendix. So this is the tinea coli. After just slowly tracing the tinea coli, you have found out the appendix. The appendix which is there, now you will hold this appendix at the mesoappendix. You will hold it by using a Babcock's forceps. You will hold the appendix with the help of Babcock's forceps, and then the blood vessels of the appendix include the appendicular artery and the branch of the ileocolic artery. These are held with the Babcock's forceps, and now the appendix which is there, this is freed up to the base, and you will apply a purse string suture like this. A purse string suture is applied here. This purse string sutures is applied all around the appendix, and now after applying a suture here, you will crush the appendix at the base. You will crush it at the base here, that is 1 centimeter above the crush. You will hold it, and then you will pass a ligature between the crushed site and the appendix. You will just pass the ligature. So this is the crushed site. Think that this is the crushed site. You will pass a ligature at this crushed site, and then you will cut the appendix. And then the stump which is there, this stump which is there, this is cleaned with the spirit. And the purse string suture which has been already put, that is straightened. So this is called as burial of the stump. Okay, this is how you do the appendicectomy. Now, the closure of the muscle, the closure, now the closure of the abdominal wall, you will put a peritoneum. For the peritoneum, you can use a continuous catgut or vicryl, and the split muscles are also sutured. External oblique is sutured, subcutaneous fat is sutured, and skin is sutured. Basically, the whole abdominal wall is sutured in layers. And then post-operative management, here you will give IV fluids for 1 to 2 days are given, and later you can start oral fluids once the abdomen is soft. What are the complications of appendicectomy? One, there can be fever. Because of infection, there is a chance of infection. Because of infection, there can be fever. That is one. Number two, the wound which is there, that can also get infected. That is, wound infection can occur. That can also lead to intra-abdominal abscess. Sometimes you can even see fecal fistula. Whenever this is not closed properly, then this can form a tract resulting in fecal fistula. And sometimes you can even see the infection which is there. That infection can reach the blood, causing septicemia. And finally, it can cause septic shock. So this is about appendicectomy. Thank you guys for watching my lecture.
Thank you, and thank you for watching.